Which of the following principles is affected by a nurse's cultural or ethnic background? A. Veracity. B. Code of conduct. C. Ethics. D. Morals. The doctrines found in the Nursing Code of Ethics have all of the following attributes except they are not. A. Meant to guide a nurse's practice. B. Mandatory. C. Universal. D. Optional. The right to self-determination refers to the A. Nurses' and physicians' rights to make the most appropriate decision regarding a patient's care. B. Physicians' right to make decisions about a patient's care if the patient is no longer able to make decisions. C. Patient's right to make decisions regarding care. D. Patient's right to choose a physician. What is the final step in the ethical decision-making process? A. Carry out the decision. B. Identify the issue. C. Make changes based on an evaluation of the original plan. D. Consult an ethics expert or committee. Which term listed below describes the idea that the nurse should do no harm to the patient? A. Autonomy. B. Beneficence. C. Veracity. D. Non-maleficence. Which of the following theories describes the idea that ethical conflicts should be resolved according to the obligations of the nurse? A. Utilitarianism. B. Virtue. C. Deontology. D. Egoist. The physician has ordered a low-potassium diet for a child with acute glomerulonephritis. Which snack is suitable for the child with potassium restrictions? A. Raisins. B. Oranges. C. Apricots. D. Bananas. The physician has ordered a blood test for H. pylori. The nurse should prepare the client by A. Withholding intake after midnight. B. Telling the client that no special preparation is needed. C. Explaining that a small dose of radioactive isotope will be used. D. Giving an oral suspension of glucose 1 hour before the test. The nurse is preparing to give an oral potassium supplement. The nurse should A. Give the medication without diluting it. B. Give the medication with 4 ounces of juice. C. Give the medication with water only. D. Give the medication on an empty stomach. The physician has ordered cultures for cytomegalovirus. Which statement is true regarding collection of cultures for cytomegalovirus? A. Stool cultures are preferred for definitive diagnosis. B. Pregnant caregivers may obtain cultures. C. Collection of 1 specimen is sufficient. D. Accurate diagnosis depends on fresh specimens. A pediatric client with burns to the hands and arms has dressing changes with sulfamylon cream. The nurse is aware that the medication A. Will cause dark staining of the surrounding skin. B. Produces a cooling sensation when applied. C. Can alter the function of the thyroid. D. Produces a burning sensation when applied. The physician has ordered Dilantin for a client with generalized seizures. When planning the client's care, the nurse should A. Maintain strict intake and output. B. Check the pulse before giving the medication. C. Administer the medication 30 minutes before meals. D. Provide oral hygiene and gum care every shift. A nurse is administering blood to a patient who has a low hemoglobin count. The patient asks how long do RBCs last in my body? The correct response is A. The lifespan of RBC is 45 days. B. The lifespan of RBC is 45 days. C. The lifespan of RBC is 90 days. D. The lifespan of RBC is 120 days. Rhogam is most often used to treat mothers that have an infant. A. Rh positive, Rh positive. B. Rh positive, Rh negative. C. Rh negative, Rh positive. D. Rh negative, Rh negative. A 65-year-old man has been admitted to the hospital for spinal stenosis surgery. When should the discharge training and planning begin for this patient? A. Following surgery. B. Upon admit. C. Within 48 hours of discharge. D. Preoperative discussion. A mother is inquiring about her child's ability to potty train. Which of the following factors is the most important aspect of toilet training? A. The age of the child. B. The child's ability to understand instruction. C. The overall mental and physical abilities of the child. D. Frequent attempts with positive reinforcement. A 35-year-old male has been an insulin-dependent diabetic for 5 years and now is unable to urinate. Which of the following would you most likely suspect? A. Atherosclerosis. B. Diabetic nephropathy. C. Autonomic neuropathy. D. Somatic neuropathy. Which of the following conditions would a nurse not administer erythromycin? A. Campylobacteriosis infection. B. Legionnaire's disease. C. Pneumonia. D. Multiple sclerosis. A client has returned to his room following an esophagoscopy. Before offering fluids, the nurse should give priority to assessing the client's A. Level of consciousness. B. Gag reflex. C. Urinary output. D. Movement of extremities. Phototherapy is ordered for a newborn with physiologic jaundice. The nurse caring for the infant should A. Offer the baby sterile water between feedings of formula. B. Apply an emollient to the baby's skin to prevent drying. C. Wear a gown, gloves, and a mask while caring for the infant. D. Place the baby on enteric isolation. According to Erickson's stage of growth and development, the developmental task associated with middle childhood is A. Trust. B. Initiative. C. Independence. D. Industry. A client with hypothyroidism frequently complains of feeling cold. The nurse should tell the client that she will be more comfortable if she A. Uses an electric blanket at night. B. Dresses in extra layers of clothing. C. Applies a heating pad to her feet. D. Takes a hot bath morning and evening. pH 7.39, PACO 244, HCO 3-26. A. Respiratory acidosis. B. Metabolic acidosis. C. Respiratory alkalosis. D. Normal. Acids have no hydrogen ions and are able to bind in a solution. A. True. B. False. C. Acid is a substance that is not capable of donating hydrogen ions. D. Acids and bases have nothing to do with hydrogen ions. pH 7.55, PACO 225, HCO 3-22. A. Respiratory acidosis, partially compensated. B. Respiratory alkalosis, uncompensated. C. Metabolic alkalosis, partially compensated. D. Metabolic acidosis, uncompensated. Which of the following processes will assist patients in obtaining necessary treatments or therapies for optimal outcome? A. Managed care. B. Multidisciplinary care. C. Case management. D. Health care. pH 7.17, PACO 248, HCO 3-36. A. Respiratory acidosis, uncompensated. B. Metabolic acidosis, partially compensated. C. Respiratory alkalosis, partially compensated. D. Respiratory acidosis, partially compensated. Health maintenance organizations and preferred provider organizations are examples of what type of organization? A. Managed care. B. Case management. C. Quality improvement. D. Healthcare. You are responsible for reviewing the nursing unit's refrigerator. Which of the following drug, if found inside the fridge, should be removed? A. Nadolol. B. Opened humulin N injection. C. Urokinase. D. Epoetin alpha 4. A new mother has some questions about phenylketonuria. Which of the following statements made by a nurse is not correct regarding PKU? A. A Guthrie test can check the necessary lab values. B. The urine has a high concentration of phenylpyruvic acid. C. Mental deficits are often present with PKU. D. The effects of PKU are reversible. High plasma PACO 2. A. Metabolic acidosis. B. Respiratory alkalosis. C. Metabolic alkalosis. D. Respiratory acidosis. Decreased plasma bicarbonate. A. Metabolic acidosis. B. Respiratory alkalosis. C. Metabolic alkalosis. D. Respiratory acidosis. What two organs in the body serve as a compensatory function to maintain acid-base balance? A. Kidneys and lungs. B. Lungs and spleen. C. Heart and liver. D. Gallbladder and appendix. The major effect of acidosis is overexcitement of the central nervous system. A. True. B. False. C. Maybe. D. Both acidosis and alkalosis result in overexcitement of the central nervous system. The nurse is suspected of charting medication administration that he did not give. After talking to the nurse, the charge nurse should A. Call the board of nursing. B. File a formal reprimand. C. Terminate the nurse. D. Charge the nurse with a tort. The nurse is suspected of charting medication administration that he did not give. After talking to the nurse, the charge nurse should A. Call the board of nursing. B. File a formal reprimand. C. Terminate the nurse. D. Charge the nurse with a tort. The client is having electroconvulsive therapy for treatment of severe depression. Which of the following indicates that the client's ECT has been effective? A. The client loses consciousness. B. The client vomits. C. The client's ECG indicates tachycardia. D. The client has a grand mal seizure. The client returns to the unit from surgery with a blood pressure of 90/50, pulse 132, and respirations 30. Which action by the nurse should receive priority? A. Continuing to monitor the vital signs. B. Contacting the physician. C. Asking the client how he feels. D. Asking the LPN to continue the post-op care. A priority nursing diagnosis for a child being admitted from surgery following a tonsillectomy is A. Body image disturbance. B. Impaired verbal communication. C. Risk for aspiration. D. Pain. The client is having fetal heart rates of 90, 110 bpm during the contractions. The first action the nurse should take is A. Reposition the monitor. B. Turn the client to her left side. C. Ask the client to ambulate. D. Prepare the client for delivery. Which of the following is a characteristic of a reassuring fetal heart rate pattern? A. A fetal heart rate of 170, 180 bpm. B. A baseline variability of 25, 35 bpm. C. Ominous periodic changes. D. Acceleration of FHR with fetal movements. Which of the following is a characteristic of a reassuring fetal heart rate pattern? A. A fetal heart rate of 170, 180 bpm. B. A baseline variability of 25, 35 bpm. C. Ominous periodic changes. D. Acceleration of FHR with fetal movements. Which question is helpful in determining the study's credibility? A. Do the participants recognize the experience as their own? B. What strategies were used to analyze the data? C. How were human subjects protected? D. Are the findings applicable outside the study situation? Which type of research study can be affected by detracting values of the researcher? A. Qualitative. B. Naturalistic. C. Ethnographic. D. Quantitative. A child with scoliosis has a spica cast applied. Which action specific to the spica cast should be taken? A. Check the bowel sounds. B. Assess the blood pressure. C. Offer pain medication. D. Check for swelling.